Hi everyone, Craig Saddlemire here with the Maine Video Activists Network. I'm doing sort of a special posting only because I attended this really incredible rally this past Saturday in Portland. It was a Healthcare for America Now rally in which people were calling on our representatives, our congressional representatives, to pass a public healthcare plan that includes a public option, among other cost-saving steps and different things like that, but most importantly the creation of a public option for the nation's uninsured and underinsured. In the next episode of the Maine Video Activists Network, I will have a complete segment on the healthcare rally that I attended in Portland, but for now I just wanted to post a really incredible speech that a representative from Senator Snowe's office gave on Senator Snowe's behalf. And the reason it was incredible is because it was the first time that Senator Snowe had come out in support of a public option starting on day one without any other conditions. And I just wanted to get this speech up because by the time I edit the actual healthcare segment, this issue might even be over. I don't know. Sometimes it takes me a little while to get episodes done these days. So without further ado, here is the clip.
Bring to you Cheryl Lehman, who's representing Senator Snowe.
Good afternoon, everybody. I can't begin to tell you how happy I am to be here today on behalf of Senator Snowe. And on a personal note, having dealt with breast cancer in the healthcare system myself last year, I have to tell you the time is now. I do have a statement from Senator Snowe, and I'd like to read that if I could. Please allow me to extend my sincere appreciation to the organizers of this rally for bringing together an exceptional group of advocates for health care reform. Our collective mission is clear: to provide every individual with affordable access to high-quality health care. We can no longer be a nation that spends more than any other, yet leaves 1 in 4 of every citizen without comprehensive care. Reform must involve extending help to families in need and addressing the escalating cost of health care by moving this system, which rewards efficiency, quality, and value. And each of us, individuals, employers, providers, insurance companies, and the government, share that responsibility. Make no mistake, our mission represents a once-in-a-time generation opportunity. This is an enormous task, one that has been attempted repeatedly and unsuccessfully for over a century. That's why it's so critical that we just now pass any bill, but that we truly transform the healthcare system. That's why, as a member in the Senate Finance Committee, I have been meeting daily with a small bipartisan group of fellow members of the committee, including the chair and ranking member, to accomplish that goal. Our committee has the dual responsibility of extending coverage as well as paying for reform. And as I indicated last Thursday in a meeting at the White House with the President, we are making clear progress. Let me be clear, I too share the goal of meaningful reform this year. It can be done and it must be done. We must also ensure, given that Americans have been waiting too long for comprehensive health care reform, that we get it right. It's imperative that our effort will dramatically lower costs and result in affordable health care. Just as crucial is that health care reform be sustainable. Our health care system must be placed on a stronger fiscal footing both now and in the years ahead. And I want this reform to be accomplished in a transparent way so that American people clearly understand what reform means to family coverage and that they have their voices heard. There's no question, we should preserve what works in American healthcare: the sanctity of doctor-patient relationships, choice of coverage and providers, private sector innovation, and that a hallmark of American medicine stays within that innovation, and the fundamental tenet that no one should be compelled to change insurance companies that they already have. At the same time, when the average cost of family coverage now exceeds $12,000 a year, it is absolutely essential that we make substantial improvements in cost and affordability. Congress must implement long overdue insurance market reforms, such as the guaranteed issue of a policy for every American, and no refusal or adverse pricing of policies on the basis of health status or gender. We also must ensure that those plans include a very strong benefit package, from preventative services to comprehensive medical benefits. And offering extra assistance to families who need help in affording a plan must be part and parcel of any legislation. I believe that the reforms we are creating will result in more competitive, affordable, and innovative options for Mainers. Yet we can all agree that we must not leave universal access to chance. That is why I also support a public plan which must be available from day one. To secure for our nation that which every other developed nation already embraces, the provision of health security for all of its citizens. The time has long come, and I promise you I will continue to work to move heaven and earth to make it happen. Thank you for the opportunity to share my thoughts, and thank you for all that you are doing to make reform a reality. Thank you so much, everybody.
Thank you, Cheryl, and thank you, Senator Snowe. It's now my pleasure to introduce John Graham, who is representing the 2nd District Congressman Michaud.